guys, so it is Elizabeth back again with another video for you guys. This one is going to be Q&A / frequently asked questions with a labor nurse. This might have to get split into 2 parts. I'm not 100% sure. Future Elizabeth, let them know when you go back in editing if it's going to be in 2 parts. But hey y'all, so it's Future Elizabeth here. I took a poll on Instagram and people voted that they would prefer a 30+ minute video versus 2 videos, so that is what we are doing here. My advice is just throw in some headphones and do some dishes or something, kind of treat this more like a podcast. You don't really need to be watching me talk. But yeah, thanks so much for watching. Enjoy! We're gonna go ahead and get started. So I asked you guys for questions on my last video. I get questions all the time on all of my videos, and then I also asked for some questions on my Instagram, which if you want to follow is Nurse Zabe, and then also I guess make sure to like, comment, subscribe here, blah 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 blah, YouTube stuff. Anywho, so I wanted to do the more general questions first that I get all the time, and then we can do some more of the specific questions that I've gotten from you guys. And just know, like, if I don't answer your question in this video, it is because of time constraints, or it's because it's a question that I'm planning on making a whole video on. So without further ado, I want to go ahead and kind of start with questions about me as a nurse. So a question that I get a lot, probably one of my number one questions, number one comments is, where do you work? Can you come be my labor nurse? What hospital do you work at? Things of that nature. And for privacy reasons, I don't really want to put out, you know, like where I'm from, where I work, those sorts of things, just, you know, for my own personal privacy. Now, if you really wanted to, I'm sure you could go online and look things up and figure out, like, where I have my license and my name, you know, my full name, all those sorts of things, because the internet is a pretty well documented place, and I have like licenses and stuff. But if you did that, you know, you do you, just kind of keep it on the DL, because I am trying to maintain a little bit of privacy, a little bit of separation between my work life and my YouTube life as much as I can. Yeah, but generally I will give you kind of the general overview. So I work on an LDRP unit, which is labor, delivery, recovery, and postpartum. So labor and delivery is in one wing of the unit, postpartum is in another. We also have a special care nursery. I'm at a community hospital where we do not have like residents or interns or anything. We're not a teaching facility. I will just deal with like attendings, but they're not called attendings, they're just the doctors. And then we do get some nursing students. I am in the southeastern part of the United States of America. And what else? I have been working at my hospital for the last like 6.5 years. I graduated from nursing school in 2013 and it was my first job. And I work part-time. I work split day and night shift because just switched that schedule. It's what worked best for my family, for childcare. And unfortunately I can't travel anywhere and be your labor nurse, although I'd love to come to Hawaii. That'd be really fun. But I want you all to know that your labor nurse is going to be caring, and they're going to care about you. It takes a special person to be a labor nurse. I feel like we get really scared because we hear of all these like bad experiences, but the only reason that you hear about all the bad experiences and that they're the loudest is because people are the loudest when they are unhappy with a situation. That's just human nature. So it takes a special person to be any type of nurse. To be a hospice nurse, it takes a special person. To be a GI nurse, to be an ER nurse, to be a labor nurse, it takes a special kind of person. And labor nurses really do care about their patients and doing best for their patients. So you don't need me. You are going to have an amazing labor nurse, and you're going to have an amazing labor and delivery. Seriously, you got this, girls. So yeah, that's kind of my number one question, is like, where do you work? Can you be my labor nurse? And my job does know that I make these videos, but I don't want to affiliate these videos with my job and have oversight from them, because again, these are just kind of my personal thoughts and opinions. And obviously I've got medical education and knowledge in these videos as well. But yeah, I just want to keep some things a little bit separate. So I hope that's okay with you guys. On to our next question. Kind of going off of that one. Specific medical advice. This isn't a question. This is just people ask me a lot of times for very specific medical advice. One, I am not a doctor. Two, I am not your doctor. Toy over there has a mind of its own. I'm not a doctor. I'm not your doctor. I'm not on your healthcare team. I am not going to give you specific medical advice. If you comment asking for specific medical advice, my specific comment might be like a general education about the topic, but more just empowering you to go and ask your doctor and to look up and figure out what questions you want to ask them, but just to go and ask your doctor and to have a relationship with your doctor where you can ask the questions, your doctor, your midwife, your personal labor and delivery nurse who's in there with your labor, because I am none of those things. For example, if you ask me like, oh, like I got into a car accident 7 years ago, this is totally, I'm making this whole scenario up, and the doctor said that I can't get an epidural and I have to go to sleep and have a C-section, da 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 da. What should I do? My advice would be go and have a consult with the anesthesiologist at the hospital so you can figure out a plan. That's my advice, because I can't be like, well, according to what you said, you're back, blah, blah, blah. No, because one, not a doctor, just a nurse. Not that just a nurse is a thing, but I don't give a diagnosis or anything like that. So I'm not a doctor and I don't know your case. I don't know everything about your back. So my videos are meant to provide general labor and delivery, postpartum breastfeeding education, but for more specific questions, especially about specific medical decisions that you are making for yourself, ask your doctor. Seek out a healthcare provider that is very knowledgeable about your specific case to make the best decision for you and for your baby and your body. Thanks for attending my TED Talk. Anywho, now that we've got those two out of the way, here are some more specific questions. And should we start most juicy to least juicy? Let's start least juicy and go to most juicy, because I have some questions that are pretty intense. So I've gotten a lot of questions about writing birth plans, having doulas, what labor nurses think about both of those things. I mean, I'm gonna be frank with you, a lot of labor nurses roll their eyes when people come in with a birth plan, but that really isn't how it should be. I prefer to call them birth preferences instead of birth plan, just because birth is one of those things that we can't plan. What we can really plan is how we react to the unknown happening to us, and I think that's a really big part of being prepared and knowing what the possibilities are so that you're better able to react to those things. I think birth plans are really good. I think it is really good to take that birth plan, those birth preferences, to a doctor's appointment when you're not in labor and go over everything with your doctor. There might be certain things that we can't do. Like at our hospital, we cannot have water deliveries because our tubs aren't designed for that. You have to have access on all three sides to have a tub delivery, and we don't have that at our hospital. So knowing that going into it is really important. I think in setting realistic expectations. Also, if there's certain things that you are planning on not having done, kind of giving your doctor the heads up, having conversations with your doctor about the risk benefit of why you don't want certain procedures performed, I think is important beforehand. Going off of that, I love a good doula. Like any profession, there are great doulas and there are doulas that are not so great. And I think interviewing and making sure that you have a really good relationship with whoever you do hire, because you are specifically hiring them and paying them out of pocket more than likely, is going to be very important. The point of a doula is to help mom advocate for herself and to help mom cope with labor. It is not to provide specific medical advice, and I think doulas that are really cognizant of that fine line are going to be the ones that labor nurses like to work with the most. Yeah, I love having more support there for mama. I love having a doula. I am a little bit, I'm on the crunchier side of labor nurses. I'm all about natural birth, obviously, but I also support women in choosing whatever type of birth they want to have, whether that is natural unmedicated squatting or it's an epidural, the whole shebang, and supporting every sort of birth in between that. So yes, birth plans and doulas, can be really great. It's helping you advocate for yourself, and then also just helping set realistic expectations for the birth process, because it is scary. It's totally unknown. So having more people in your corner is not a bad thing. Just make sure that it is somebody that you really connect with, I think is important. So a question that I have had come up a few times is, this is a little bit juicy or a little bit controversial. Can you do a 10 things your labor nurse wants you to know about circumcision? So for my viewers that are not in the United States, in the US, there's a lot of circumcision, male circumcision specifically going on. I am gonna be frank with you guys, I'm not a fan of circumcision. I don't like it. I would not circumcise a girl. I would not circumcise a boy, and it is legal. I will support people, you know, if that's their educated choice and they want to circumcise their son. It is not my place as your labor nurse to say a thing about it. I do not offer my opinion to my patients, but this is me personally speaking as a mom and as a nurse. I am not a fan of circumcision. I do not want to make a 10 things your labor nurse wants you to know about circumcision, because I think that that would be more, if I were to make a video about 10 things your labor nurse wants you to know about circumcision, I think that that would kind of make it seem like I think that it's okay, and I don't think it's okay. I think there's a lot of good education. If you want something a little bit on the lighter side, Adam Ruins Everything does a good thing about circumcision. But yeah, I'm not a fan, and I don't want to make that video, so that's why I haven't made that video. I know that that's been something that's been requested, and I'm sure me explaining all of this, my my viewers who are not in the US are like, well duh, yeah, we don't like circumcision either. I think it's unnecessary, and I think it's a necessary painful procedure. So that's my 2 cents on circumcision. But I'm not slamming anybody if that's what you chose to do. It's not my decision to make. It is legal in the United States, and yeah, but I'm not going to make a video on it, and I'm sorry if I hurt anybody's feelings. I really try not to, but it is what it is. That's the tea, that's the truth. So a question I've gotten a few times is, how do I fire a nurse? Yeah. Well, here's the thing. It depends. Are you wanting to switch nurses because you are not liking her personality? You guys aren't clicking? Not everybody clicks with everybody. I definitely have had patients who are like, who is this weird, pale, 12-year-old looking child taking care of me? Hello, I'm Elizabeth and I look like I'm 12. But yeah, if they didn't want me to be their nurse, or if you don't want somebody to be your nurse, you know, for those reasons, not for like, she is clearly intoxicated on the job or she's done something really dangerous, then I think the best thing to do would be for somebody who's your support person, or you yourself, depending on where you are in the labor or postpartum process, to speak privately with the charge nurse, so that the charge nurse can reassign things without fully letting the nurse know. If it's just a personality thing, isn't meshing, then, I mean, some people just have really strong personalities, and you know, some patients love that and some patients don't love that. And you know, at the end of the day, we're all human, and at the end of the day, we all have feelings. And you know, a nurse finding out that the patient doesn't want her to take care of her because their personalities don't mesh is kind of, I mean, that's really painful. So if you can do it in such a way that you're just letting the charge nurse know, hey, I want to switch, but if it's for something that's unsafe, I still think you need to let the charge nurse know. But you might also want to ask to speak with like the nurse manager on the unit, or just go up a chain of command in some way, just because obviously we want everybody to be practicing safely. But a lot of times it's just, sometimes personalities don't mesh. And just remembering, again, nurses are humans, and some days they've had a really, really bad day and they bring that into work, and they shouldn't. But again, we're all human. Sometimes we do it. When the other night I got called into work and I was like, oh my gosh, like I'm gonna be here all night. I don't want to be here. Like I'm so tired. And then I was like, Okay, that's all true. But also, you're getting called into work because somebody's gonna have a baby and their life is about to change, and it's gonna be like beautiful and magical and amazing, and just to kind of remember that too. And when I put that spin on it, that really helped me not bring any of the negativity that I was feeling about getting called in to an extra shift into work. So not everybody can do that all the time. I'm sure I can't do that all the time depending on what's going on, but yeah, everybody's human. Sometimes humans don't like each other. Sometimes personalities don't mesh, and that's okay. It's okay to ask for a different nurse. What's not okay is to do it in such a way that really hurts the other person when all that's going on is that they just don't have a great personality for your personality. I hope that made sense. Yeah, so delicately, I wouldn't even ask your nurse to speak to the charge nurse. I would have somebody go find the charge nurse and just do it in a delicate way. Another question that has come up a few times is how to kind of disclose certain things to your nurse in the best way possible, particularly if you have suffered from abuse in the past, things that might affect your labor and affect how you are coping with cervical checks or pain or things like that. And I think the very best way to do that is to have a discussion with your doctor before you come in, if you feel comfortable enough to do so, and to have that noted in your chart so that your nurse knows when they get your prenatal, they can look at it there. Or have your support person have that be conversation that you want your support person to have with your nurse. In the same way, if you have something going on that you don't want other people to know, let them know that, and they can note that in your prenatal. Like sometimes people have herpes and they don't want anybody to know. So we can have private conversations about things. Your nurse should ask if you feel safe at home. That should be a question that is asked when you are admitted. We know that abuse tends to heighten in pregnancy, and so that's something that we're definitely looking and screening for. And just if you have that history of abuse, just know that we are going to be as accommodating as possible, and you can always decline vaginal exams and or have a plan about how to best deal with things that you might find traumatic. So we are here to make the birthing process as comfortable for you as possible, and sometimes having that history of abuse, things get pulled back up when we have a delivery, because we're in some sensitive areas where things have happened that are horrible and traumatic. And so I think making sure, sometimes it could be helpful too to have a doula with you who's really going to be cognizant of that and really be a good advocate for you in that regard, if that's something that you can afford. But yeah, I think just having somebody whose job it is to tell your nurse, and then your nurse is going to mama bear on out for you, and make sure that we are as accommodating and accepting and making this the best experience that it can be for you. Whether that's limiting vaginal exams, making sure that we have an epidural as soon as possible, making sure that we have only females in the room and a female provider. So things like that, we can definitely make sure that we take care of you the very best that we can. Moving on to questions that were kind of specifically asked to me. I have my laptop here. Okay, so here's a question. I get breastfeeding questions all the time. I just want to reiterate, I am not an IBCLC, but I am working towards becoming one. I actually just got a study book today. I'm going to start studying for the exam. Does one breast being significantly larger than the other affect breastfeeding? No. It's not the size of the breast that matters. It is what's going on inside the breast that matters. And it's really hard to know exactly what your supply is going to look like until you get milk. But even if you have one breast that is not producing as much milk, the other boob can totally pick up the slack. That is the nice thing, is that it's all supply and demand. Some people exclusively breastfeed off of one side. Typically you do have one side that makes more milk than the other side, and I feel like it's for a myriad of reasons. So that side might generally just have better ductwork. It might also be how you're holding the baby. It might also be how fast your letdown is, and so a faster letdown baby wants to nurse more on that side. So the supply and demand, that side makes more. For most women, I believe the right side makes more milk, but for me, it's always been my left side. So, but you can feed a baby off of one side. I know people who have had unilateral mastectomies and been able to feed the baby off the other side, or people who have twins feed a baby off of each side. So that's not anything that I would be concerned about right now. So, does being on bed rest for more than 3 months of pregnancy guarantee a C-section? No. But other things that could put you on bed rest could guarantee a C-section. If you had a placenta previa where the placenta is over the cervical opening, then you will need a C-section. That is a great question for your OB. Oh, here's a funny question. What's the most annoying thing a patient can do? Not in a mean way, or maybe in a mean way. What's one thing that you wish that they would just stop doing? Well, one thing I wish that human beings would just stop doing is vomiting. I don't like it, and it's nasty. But you know what? Throwing up does the work of 3 contractions, so we'll take it. And do not feel bad if you puke. I just personally don't like vomit. I don't know anybody who likes vomit. What's an annoying thing that patients can do? I think something that I find annoying... Oh, this is a tough one. Because I'm thinking of things, but I'm like, well, that's not that bad. I struggle with patients who are not thankful or not... I mean, you don't need to like write me a thank you note for everything that I do. Lord, no. But like people who get mad at me for helping, and you know, it's one of those things, maybe our personalities aren't clicking, but that is frustrating for me because I'm always, you know, trying to provide the best care that I can. I don't know, that's a tricky one. It's the most annoying thing a patient can do. I don't know. Labor and delivery nurses, comment down below. What's the most annoying thing a patient can do? I always tell people that as long as they don't kick me in the face, we're good. But then I had a patient with an epidural accidentally kick me in the face, and she was like mortified. And I was like, girl, we're good. It was an accident. But honestly, you could probably kick me in the face and you'd still be good. I mean, I understand having a baby is uncomfortable. What are good gifts for labor and delivery nurses? So, in my 10 things your labor nurse wants you to know, kind of my original labor nurse video, thank you notes. And honestly, if you can do it in such a way where the feedback is going first to like a manager and then to us, those go in our file, and that's the very best thing you can do. Or food. We love food. But most places are not going to let us accept like anything with like a big monetary value. Most hospitals are kind of frown upon that. So, but you know, I'm always down for food. Always, always, always. I love eating. My question is, why are American hospitals obsessed with giving birth on your back? Somebody answered this already. It's easier and more convenient for the medical staff. Yes to that, but also that's how they were trained. And so the only way we're going to change that is by changing things up and learning how to give birth in different positions. Because when patients give birth on hands and knees, it is crazy looking. Just because it's something that we don't see very often. And obviously it's we're working on changing that. We know that we got to change positions to help that pelvis get into the very best position to let baby out. But yeah, it's not only that it's easier and more convenient for the medical staff, because honestly the easiest, most convenient thing is for the baby to come out, but also it's just that that's how they have been trained to do. And so we have to work on learning new things. What is the best food bribe for my medical team when I'm in labor? Ooh, I love this. I know I can't focus when I'm hungry, so I want to make sure that they can focus on me and the bean really, really well. LOL. I love that. So, Sweets are good and savory. Both. I'm so not helpful. I'm actually hungry right now. Cookies. What's really, I've had a few patients in early labor. They're like, well, I wasn't sure if I was in labor, so I made cookies. Fabulous. Honestly, whatever you bring. And you don't need to bribe your team to take care of you well, but I do like food to focus. I just like food. If you just bring us food, we will be happy. Oh, here's a good one. Question for an L&D nurse. Is it possible to push back a swollen cervix, or do you have to wait for the swelling to reduce first? And is that the only possible with an epidural? So, it depends. Sometimes it's possible to push past a swollen cervix. Sometimes it's not. The cervix does not go away. It's kind of like you're putting on a turtleneck sweater, so it thins out and then kind of goes back behind the baby's head. So sometimes if we have some cervical swelling, that can be an indication that baby is in kind of a funky position. So changing positions, hands and knees, something with a peanut ball to really open our pelvis can help with that. I definitely, it's not something that I would do without the consult of a doctor, pushing back a swollen cervix, but I've had patients do it who do not have an epidural, and I've had patients do it who do have an epidural, and I've also tried with both of those patients and been unable to. There is some new research that IV Benadryl actually can help with the swollen cervix. I have not seen that in practice, but next time I see a swollen cervix in practice, I am going to suggest that and look into research with that with the doctor, because I think yeah, swollen cervixes are no fun, and it's really a big bummer to stay at 9.5 centimeters for, you know, forever and end up with a C-section because you can't push past that swollen cervix. How do you feel about birth plans, hypnobabies? I already talked about that. Honestly, girl, whatever helps you get the baby out. Hypnobirthing's cool. I personally have not done it, but I know other postpartum labor nurses who have done it and they loved it. When will you make a video on twin delivery? I'm due in January, so I actually have it all compiled. I just need to make it, so it might be my next. It'll definitely be before January. I'm hoping to get it out sometime in November. How long does a mom stay in the delivery room after baby is born? So this actually depends. It depends on what kind of unit you're delivering on. So some labor and delivery units are completely separate from postpartum. Some it is all one unit, but they're in a separate wing. That's how ours is. And some labor and delivery units, you labor, delivery, recovery, postpartum is all one room. But at our hospital, we do 2 hours recovering before we get up and pee and then go to our postpartum room. When is it too late to get an epidural? This is a good question for your doctor, because every hospital has different policies. Some will let you get an epidural past 8 centimeters, which I personally am not a fan of, because my personal piece of advice, or what I tell patients when they come in, is you can get an epidural until you can't sit still and the baby's coming. But sometimes, especially if it's not your first baby, sitting up for an epidural, the baby's like, I'm coming, and then you lie down and you have a baby, sometimes without getting the epidural. But I have had patients get an epidural while they're pushing. So it just depends on the facility. If I had an episiotomy with my first baby, am I more likely to have another one with my second? Not necessarily. Depends on why you had the episiotomy. But you, because you have that scar tissue, are more likely to tear along that scar tissue. And that's the same for just if you had a tear. You're more likely to kind of tear along that scar tissue, because scar tissue isn't as stretchy as regular tissue. Here's a good one. I feel like nowadays every mothers are judged for getting an epidural. I'm 100% planning on having an epidural. My labor nurse is going to be judging me for choosing not to have a natural birth. Girl, no. Not at all. I'm crunchy. I love natural labors, but guess what? I love epidurals too. It's a wonderful tool. Pain versus suffering. I have a whole video on it. And you know what? You don't need to suffer unnecessarily. For sure not. Yeah, so no. And you're totally good either way. We're just there to help you have the best birth that follows your desires as closely as possible and keep everybody safe in the process. What's the truth about redheads in labor? Do they really bleed more and have a higher risk of hemorrhage than non-redheaded people? If you ask any labor nurse, they're going to tell you that is true, but there's no evidence behind that. Are we going to have extra bleeding drugs in the room? Probably. Are we going to push on your belly a little extra hard? Probably, but there really isn't any correlation or evidence behind that. But redheads do have more issues with anesthesia. They need more anesthesia than non-redheaded people. So that's kind of cool. How long can you go without getting an epidural before they say you can't anymore? When would the nurse prefer you get one, earlier or later? I kind of already answered the first part of that question, but the second part, would a nurse prefer you get one earlier or later? This nurse would prefer that you get one whenever you darn well please, as long as it's appropriate. I'd like you to be in active labor, but sometimes when we're inducing or augmenting with Pitocin, that's not always the case. But I'd like you to be up and moving around as much as possible. I'd like us to try other pain relief first, and I would like you to get an epidural when and if you want an epidural, because this is your birth. I guess personally I prefer if somebody got it a little bit later versus earlier, just from a getting baby in the best position standpoint. But if you're in pain and you're 1 centimeter and you're on Pitocin and you are really working through the contractions and they're palpating strong, I'm going to advocate for you to get some pain relief from the doctor, because you are my patient and I am going to advocate for you. You resemble Drew Barrymore. Have you heard that before? Girl, all the time. About half of my comments are telling me that I look and sound like Drew Barrymore or Sarah Paulson, and I think it's because we all have a little bit of a lisp. Oh, you should do one about fruits that we shouldn't eat when we're pregnant. I hear a lot about pineapple. You can eat pineapple when you're pregnant. There is some thought that bromine in the pineapple can induce labor, but you would have to eat a lot of pineapple, including, like, I think the core of the pineapple. The big thing with fruits and veggies is that you want to make sure that you are washing them really well, so that you aren't exposed to potential diseases, bacteria that can be harmful to the baby. So washing everything really well with soap and water is going to be more important than what fruits and vegetables you. Ooh, I have a question about breastfeeding with implants. That would be a great question for an IBCLC. Sometimes implants can cause issues because of your milk ducts not actually being connected anymore to the nipple. But that would be something I would try and ask a lactation consultant, and also maybe get like the notes from the doctor who did your initial breast implant procedure. And some women do struggle with supply, like they're not getting as much milk as they would hope to get. But yes, there are women who do successfully breastfeed with implants, but I'm not 100% sure about how the implant being put in affects, like which one is better for breastfeeding. Okay, I think I'm going to end with this one. So for my frequently asked question video, this person is curious about what's the #1 piece of advice you would give to somebody planning to become pregnant. So I think the #1 piece of advice is to go have a preconception visit with your doctor or your midwife, and go in, talk with them about concerns, maybe get some blood tests to see. That's when I actually found out I had the hypothyroid, was during a preconception visit, and just kind of get on the same page, get everything checked out, make sure everything's good, get your pap smear if you hadn't had one in a while, and just make sure that your body is the healthiest that it can be, so that you are able to hopefully conceive easily and carry a pregnancy to full term. But yeah, thank you guys so much for watching my video. I really appreciate all the questions. I know that I didn't get to everybody's questions, but this video is getting super long. So definitely, if you've got any more questions, leave them down below. I can do a Q&A with a labor nurse part 2 any old time. So bye guys.